Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is Laurie Elliott, and she's here to talk about the North Carolina Healthcare Affordability Listening Project. Wow, that's a mouthful.
It is a mouthful.
And I may not have gotten all those words in there, but Laurie, tell me about this project.
Sure. So I'm just going to give you a little bit of background and really appreciate you giving me this opportunity to spread the word on this important project. So United States of Care is a nonprofit organization, and its goal is to build a better, more equitable healthcare system in the wake of the pandemic. So why does that matter? So I'm just going to give you some research. So 42% of voters have gone without health insurance in the past because of costs. That's a lot. 22% of voters are concerned about losing their own coverage due to a job change. And 68% of voters are aware that some people face inequities when seeking health care. And so what we want to do is to listen to people's stories about their challenges with affordable care. And United States of Care, on their website, they say, I felt like their description was better than anything I could ever come up with. But so we are listening to people's needs, developing policy solutions, and partnering with others to ensure our healthcare system works for everyone. And there's an urgency to act now, because when it comes to people's health and well-being, waiting for tomorrow is not an option.
And you've heard some personal stories from some folks about waiting for health care or the need for health care. Can you tell me a little bit about that?
Yes. Well, the story that really stands out to me is the story about a man who worked for years as a professional, had great insurance and benefits, and then he suffered a heart attack. And after the heart attack, he just was not ever able to recover to the point where he could do the job that he used to do. And he basically lost everything and was living in a homeless shelter. That's actually, at the time where I met him, was at the homeless shelter. That just breaks my heart.
And medical care, as we all know, can be very, very expensive. And almost overwhelmingly expensive when you see those bills. What are some of the common causes of medical debt?
So I think a big cause is because people just can't afford the monthly premiums on the healthcare coverage, and so they just don't carry insurance at all. And then another cause is that even if someone has health insurance, they may have a very high deductible. So if something were to happen unexpectedly, like maybe they needed surgery or maybe they needed to be in the hospital for a time, then they would have to pay thousands of dollars in many cases before their insurance coverage would kick in. And some people just, the only way they can do it is to get a credit card. And if you don't pay your bill on time on that, your interest rates go up and they charge you with fees, and then it can be something you just can't get on top of.
Right, and I mean, I think so many things can happen in an instant. A fall, it doesn't have to be a health diagnosis. It could be something as simple as a fall or an unfortunate car accident that could put you in that need.
Absolutely. So one other cause is related to inadequate health care coverage. So let's say someone has health insurance, let's say someone with diabetes. They have a great health insurance plan that covers their visits, but the cost of the medication to manage their diabetes is so high that they can't afford it, and can go into debt that way, because it's not like they can't go without. They really need it in order to survive.
And I do think we see a lot of that. People have to make a choice. Do I eat or do I take this medication?
Right. And people with high blood pressure, that's another chronic condition that can put people in that situation. Yeah.
And we have another nonprofit partner that we also talk about life-saving medications with. The heart medications, high blood pressure, cholesterol, diabetes, all of those things, those medicines can get very expensive.
Definitely.
What's happening here in Caldwell County about this?
Yeah. Glad you asked, because we are in partnership with the United States of Care, which is the nonprofit I talked about, and the North Carolina Justice Center, of course, which is our local organization. We're holding a listening session in Caldwell County because we want to hear from people about their healthcare experience. And so on August 13th at the J.E. Broyhill Civic Center from 5:30 to 7:30, there will be some representatives from the nonprofits as well as myself, and then we're looking for people who are between the ages of 50 and 64 and are residents of Caldwell County to share their stories so that we can hear about what the needs are and look at some possible ways to improve. Now there's benefits.
There are benefits. I was looking at these benefits.
Yes, so as a thank you for being willing to tell their story, the participants will receive a meal during the discussion, and then at the end of the listening session, they will receive a $75 gift card. So I thought that was a very generous offer, but they also feel like it's important to, show the value of their sharing with us.
You've mentioned a little bit about who you're looking for, but tell me that one more time.
Sure. So we're looking for Caldwell County residents. Basically, if you have an address in Caldwell County, you're a resident, and between the ages of 50 and 64. And we're looking for people of all backgrounds, all income levels. Sometimes people think it's, limited, but we just want to hear from anyone in that age group who has experience with either medical debt or inadequate health coverage and would want to share their story so that we can, hopefully help other people.
So how do people sign up if they're interested?
They can contact me. I'm Laurie Ellian, and my phone number is 828-3020-557. They can call it or text it. And I also have an email address, which is on a flyer that we have. But the easiest way is probably just to call 828-3020-557. And if you don't get me, and you get the message machine, please leave your name and a number where I can call you back.
Very important. Don't just hang up.
Yes.
As I sometimes do when I call
too.
my friends and family. I'm like, well, they know I've called. So.
Yes.
Lori is not gonna know who you are if you just hang up.
Exactly.
Are there ways the audience can help?
Definitely. So, this situation may not apply to the people who are watching, but they may have a friend or a family member that is in that situation. And so, people are more likely to act on something if they get a referral from a friend or a family member. So if anyone could spread the word, then that would help us out a lot. And we are hoping to get all of our participants set up by the 7th of August, so that's next week, because we do have to let the chef know what the head count is. And so there is urgency to this.
Right. And the J.E. Broyhill Civic Center, the chef there, very good food.
Yes, very good food.
I mean, I know that's not relevant, but it will be a good meal.
Yes.
I will say a good meal, and probably fancier than what most people eat at home. Not different food. It's kind of fun.
Well, and it's nice when someone cooks for you.
It's always nice when someone cooks for you.
Yeah.
All right, Laurie, and this event is on August 13th, but to get involved, people need to contact you by August 7th.
Right, right. We just need to make sure that we have, you know, I have to send the information to the United States of Care, and that'll save them a spot, so we don't end up getting so many people that show up and then we can only serve so many.
Right. Right. Well, thank you for coming. Is there anything we've forgotten to talk about today?
I don't think so.
All right. Well, if you're interested, reach out to Laurie because she can get you set up to be a participant in this event.
Thank you so much.
Thank you. And thank you for watching Caldwell County Today.